to the 17th Annual Global Healthcare Summit, the flagship event of American Association of Physicians of Indian Origin in India. This year, we are privileged to associate with All India Institute of Medical Sciences, Delhi, and I welcome you all in this flagship event of API. So from here, I welcome our India convener, Dr. Chanchal Pal, to take from here. She is the convener of Delhi GHS. She is also the past president of AIIMS South Delhi branch, and she is a very renowned ENT surgeon at our Indraprasth Apollo Hospital. So I welcome Dr. Chanchal Pal. Please give her a huge round of applause.
Thank you, Shubham. Good morning, everybody, and very happy New Year. Before we start, let's call some dignitaries on the dais. May I request Dr. Indrapal Chabra, please, to take the chair. Dr. M. Srinivasan, Director of AIIMS, kindly come over. Dr. Sampath Shivangi. Yeah, I think keep giving applause. It gives you warmth also. Dr. Lokesh Idara, please. Dr. Samuel Raval. Dr. Anjana Samadar, President API. Dr. Bhavani Srinivasan. And Dr. Anupam Sibbal, our guest of honor. Kindly decorate the stage. So we'll have inaugural function when our chief guest come in the afternoon. So we are just opening the CME session with opening remark. So on behalf of 17th Global Health Care Summit 2024, I welcome you all to this inaugural ceremony and to the summit. I'm sure with the scientific program and such a nice scientific fiesta, all of us will get benefited for the better patient care. I welcome all the delegates and the faculty from USA who has come all the way to attend this, and also Indian delegates and the faculty. I'm sure we'll have good exchange of knowledge, especially in field of recent advances, AI and robotic surgery. So we are looking forward to good even more 2 days of CME here. With this, I request Dr. Indrapal Chabra to kindly give introduction of the course. He is a very senior internal physician at New York, very popular one, and a very good speaker and a key person in API. Dr. Indrapal Chabra, please.
Thank you. Thank you, Dr. Chanchal. So, like she said already, welcome. Happy New Year. We are going to have a very good 2 days of events and programs about the cutting edge in healthcare. And we will have a very nice forum on AI in healthcare. And the highlight, I think, especially for the students and the PGs and the residents, is an excellent forum on medical education, not just in India, not just in the US, but even from UK. Dr. Hasmukh Shah is a very prominent physician member of BAPIO. He's going to be joining us in that forum. So make sure you don't miss that. So, and then there are some events, as you all know, some events are happening right here today and tomorrow. A couple of events are happening at Le Meridien Hotel in the evening. That's for invited guests. That's going to be a CEO forum and a women's health forum. So that's for the invited delegates. And just some housekeeping rules. All those folks from the US, my US friends over sitting in the front, if we do have CME credits through the help of eMed events. Thank you, Priyaji. And so you will be able to get those CME credits only if you scan the QR code. As you walked in, you probably saw a QR code, a big board with a QR code. We'll display it over here also. Make sure that you scan that, and only then you can claim credit for those CMEs. And that's going to be very important for all of us for housekeeping. And with that, I thank you and hope you will have a great session. So to start off, yeah, okay. So let me just introduce from From my right, Dr. Bhavani Srinivasan. She's an excellent physician in New York, my neighbor. She's a great member of RP of Queens and Long Island. Dr. Sumul Rawal is a neuro-oncologist in New Jersey. Dr. Lokesh Adara, he's the chair of the board of trustees of API, excellent physician. And of course, Dr. Anupam Sibbal, he's the reason he dragged me into this. I'll talk to you about it afterwards. we both went to the same class in MAMC in 1986, so I can take some panga with him. So, of course, Dr. Srinivas, our host, thank you so much for agreeing to do this at this prestigious institution. You may not know, in 1985, there used to be a course in BSc in human biology. I was a student here at that time. And then in 86, I went to Maulana Azad. And Dr. Anjana Samadar, she's the president of API, a very dynamic lady. For those of you who noticed something, she had survived against all odds during the COVID pandemic. And now she's leading this huge group of API physicians. A very courageous lady. And then last but not the least, Dr. Sampath Shivangi. He is heading the second part of the Global Health Summit will be in Manipal. He's an alumnus of Manipal and a very prominent member of API in the US. So thank you very much. And we'll have the official inauguration. We are expecting some dignitaries to come. We don't know the time yet. Once the dignitaries are here, that's when we'll have the proper inauguration. This is just some opening remarks. So, Dr. Chanchal.
Thank you, Dr. Indrapal. So we have Professor Anupam Sibbal to kick-start the morning with his excellent oration. Is really excellent orator. A brief about him. He's got huge introduction. I'll just take brief of it. He's a group medical director of Apollo Hospital Group, India's biggest corporate healthcare provider with 75 hospitals and 10,000 beds. He established the division of pediatric gastroenterology, he's a pediatric gastroenterologist, and hepatology in 1997 at Apollo Hospital. He helped set up the first successful pediatric liver transplant program in India at Apollo, Delhi in 1998. The Apollo Hospital transplant program has performed more than 4,200 liver transplant, out of which 508 have been children, which is the highest in India. Professor Sibbal served as president of Global Association of Physicians of Indian Origin, GAPIO, from 2020 to 2022. The aim of this organization is to bring together 1.4 million physicians of Indian origin in 57 countries of the world on one professional platform. Professor Sibbal is author of national bestseller, Is Your Child Ready to Face the World? He has also been on editorial board of 3 journals and 149 publication on his. He has edited a textbook of pediatric gastroenterology, hepatology, and nutrition. He has edited a book on quality of life improvement, quality nomics, and he has lectured extensively in India and abroad. But his recent passion is to promote our nation, the India, the Bharat, and he will talk about it. And I think he's excellent orator, and we are proud of you, Dr. Sibbal. Kindly enlighten us. Thank you.
Good morning, namaste, Dr. Srinivas, my dear friend Dr. Anjana Samadar, Dr. Gautam Samadar, Dr. Sampath, Dr. Samul, my batchmate Dr. IPS, Lokesh, Dr. Shivangi, Dr. Chakravarti, eminent members of the leadership of API, friends from the US, other parts of the world, and of course, our friends from India. Really delighted to be here this morning, and I'm going to sort of take us on a journey over the next 15 minutes, and I'm going to ask ourselves this question: can India become the Wish Guru in healthcare? And then I'm going to leave it to you to answer that based on some of the data that I'm going to share with you. But before we talk about can we become the Wish Guru in healthcare, let's sort of look at areas where we were once a Wish Guru, where we are a Wish Guru, and very importantly, where can we become a Wish Guru? So let's go back and talk about where we are a Wish Guru. A love for peace. In our glorious history of 10,000 years, India has never invaded any country, and Gandhiji gave the world the message, an eye for an eye only ends up making the whole world blind. Our deep commitment to democracy. In the last general election, 603 million Indians voted, which is more than the combined population of 5 of the G7 countries. And what can be a bigger testament to the vibrancy of our democracy that for one voter, Mr. Darshan Das, who lives deep in the Gir forest in village Banej, the Election Commission has been setting up a polling station because no Indian should have to travel for more than 2 kilometers to cast her or his vote. We have 22 official languages, 1,369 recognized dialects, and we are still one country. So we understand diversity, inclusivity. Adaptability. Indians can be found in all but 3 countries of the world, and wherever we go, we leave an indelible imprint. And these are just 8 examples of head of government, head of state, very important political positions held by people of Indian origin. Where were we once a Wish Guru? And that is in the area of knowledge. If we look at the oldest universities in the world, they were established in India. In the last 7-8 decades, we've made considerable progress now in higher education, and this is just a snapshot of where we are. We have 149 institutes of national importance, more than 1,000 universities, more than 50,000 colleges. We have the 4th highest number of doctoral graduates in the world, the 4th highest research output in the world. We produce 6.5 million graduates every year, 1.5 million engineers, 300,000 MBAs, and 100,000 graduates. We have 23 IITs, 20 AIIMS, and I'm highlighting the AIIMS and IITs because Indians now head 25 global companies that have a combined market cap of more than $5 trillion. And there are only 3 countries in the world that actually have an economy bigger than 5 trillion. And most of them went either to an IIT or an IIM. We were once the seat of commerce. 1/3 of the global GDP, 1/4 of the world's industrial output came from India. But again, we've made some remarkable progress over the last few decades. We are the 3rd largest economy in the world in terms of purchasing power parity, the 5th largest economy in terms of nominal GDP, and we will become the 4th largest economy by the end of this year when we overtake Germany. This is some very interesting data, and I want to pause and urge you to spend 10 seconds on this. By 2047, when we complete 100 years of India's independence, 20% of the world's middle class will be in India. Every Indian born after the year 2000, and there are quite a few of you here, will spend $240,000 in each of their lifetimes. Multiply this by 1.6 billion people, which will be our population in 2047. Imagine the size of our market. We made remarkable progress in the area of financial digital empowerment, and UPI is an example. With this, you don't need a credit card. For our friends from America, you do a transfer from one phone to another without actually having to do net banking. 10 countries in the world now use it, including France and Australia. And more than 2,300 transactions take place per second. We have data from 2022, we don't have for 23, but 46% of the world's real-time payment transactions happened in India. And more than 10 billion transactions happen per month using UPI. So from buying an ice cream to going to buy vegetables or anything you want, you actually do not need a credit card, and all you need is a cell phone. We have an opportunity to become a Wish Guru in the area of green energy. We are the 3rd largest producer of renewable energy now. Our renewable resources are going to go up considerably over the next few years. 40% of our electricity capacity is now from non-fossil fuels. Solar power installations have gone up by 25x in the last 9 years. And we have the 4th largest wind power capacity in the world now. Turning to health. When we became independent, our life expectancy was 32. It's now more than 70. Infant mortality rate was 150. Now it's 26.6. In terms of digital health, some truly mind-boggling figures here. Arogya Setu, which really tracked how COVID was progressing in the community, became the most downloaded app in the first 2 weeks of its installation. And through COVID, we have access to 2.12 billion vaccination records. Through eSanjeevani, which is the telehealth portal, there are 194 million teleconsults that have already been performed. eICUs are a reality today, teleradiology, digital pathology, and of course, we are making forays in AI and ML, because let's not forget that the 5 million Indian IT professionals create the software that the world functions on. So in the years to come, we will be leaders both in AI and ML. Ayushman Bharat Yojana is redefining healthcare delivery. So there are 4 pillars. We have the health and wellness centers, and 170,000 of them. We have the Ayushman Bharat Pradhan Mantri Jan Arogya Yojana (PMJ) that aims to provide coverage for 5 lakhs a year to 10 crore families. So that's 50 crore individuals. 28 crore cards have been issued. More than 6 crore hospital admissions have taken place, and 77,000 crores have been spent on this. We also have the AB Digital Mission, and we also now have the AB Health Infrastructure Mission. And what the Ayushman Bharat Digital Mission is trying to do is to bring all the stakeholders, the providers, the patients, the insurers on one platform. And of course, there might be skeptics on how this is going to be possible given our large size, but just want to remind everyone that we have the largest biometric ID system, Aadhaar, which is based on iris scans, with 1.33 billion Aadhaar cards having been issued. And I'm going to just turn over to 2 programs that the government of India is now supporting. And the first is Heal in India. Now, India has launched satellites for 36 countries, including the United States. We have the capability of launching more than 100 satellites in a single mission. India's Mars Orbiter mission was the first mission in the world to be successful in its maiden attempt to enter the orbit of Mars. And while gravity cost $100 million to make, guess what? The Mars Orbiter mission cost only $74 million. And I guess some of you have seen Interstellar, which was made a year later, and that cost $165 million, whereas our Chandrayaan 3 cost $75 million. Why am I talking about space in a health conference? Because countries decide on choosing who their partner is going to be in space technology based on 3 parameters: technology, expertise, and cost. And when it comes to patient care, these are exactly the same parameters that countries and individuals look at before choosing where they're going to get treated. So if technology, anything's available anywhere in the world, it's available in India. This is just an example of the Proton Center, the first in South Asia to be established a few years ago. If a procedure is done anywhere in the world, it's done in India with outcomes comparable to the best centers in the West. Just to give you a snapshot, 320,000 joint replacements in a year, 300,000 open heart surgeries, about 28,000 robotic surgeries, 23,000 transplants. India performs 8% of the world's kidney transplants, 5% of the world's liver transplants, and we at Apollo perform 1% of all the transplants in the world. And we are able to take on challenging cases that many countries will not. And this is an example of a girl from a village near Karachi, village Mitti, and she has atlantoaxial dislocation, and she's never stepped out of her house because she would have excruciating pain with every step she took. And this is her after her corrective surgery outside in the open. These are the kind of patients we're able to take on. This is a baby from Philippines, and just look at her belly. She has Caroli syndrome, deep jaundice, skin and bones, very high-risk liver transplant. This is her after her transplant a year later, and this is her 5 years later. This is a set of twins from Tanzania, difficult separation, and this is them, Adriana and Brianna, after their separation. Of course, the cost advantage that India has makes it really attractive, 1/10 of the cost in the US. And therefore, it's not surprising that India is emerging as the global healthcare destination when it comes to medical travel. Now, turning to the last point that I want to make, which is Heal by India. We have a rich tradition. The Charaka Samhita, dating back to 400 BC, talks about kindness in health. We're a young country. 43.6% of our population is less than 24. Why is this important? Because if we look at the old age dependency ratio, which is really the number of people older than 65 who are dependent on the working population, look at where Japan is, 50%. Look at Europe, close to 30%. North America, upwards of 20%. China, 15%. India, at about 5%. And this demographic dividend is really going to pay rich dividends. We are going to have a huge amount of people in the workforce in the years to come. There are going to be 800 million Indians in the workforce. There will be a time when we will have 1 billion people in the workforce in the next couple of decades. But right till 2100, we're going to have at least 800 million people in the workforce with lots of dreams, lots of aspiration, wanting the very best for themselves and their families. And therefore, India is going to have the opportunity to export expertise. We have exported services, now we will export expertise. The world will have a shortage of 12.9 million healthcare workers by 2035. This is the World Health Organization estimate. And India has the ability to create 1 million healthcare professionals every year. And medicine's really popular. 1.8 million students took the exam for 100,000 plus MBBS seats. So there are another 17 lakhs who wanted to do medicine. If we look at the number of medical colleges, they've gone up from 387 to 706 in the last 9 years. MBBS seats have more than doubled from 51,000 to 108,000. They'll become 120,000 in the next 3 years. And the number of medical schools will go up to 725. Postgraduate seats more than doubled from 31,000 to 67,000. There's always been this concern that we don't publish enough. So I just did a PubMed central search and looked at COVID papers. So 620,000 papers, 14% of publications were from India, 1,121 were from AIIMS, 730 came from Apollo, and 699 from PGI. So we are now publishing more than ever before. And with all the new legislations that we have in place, whether it's the National Medical Commission Act, the National Commission for Allied Health and Healthcare Professionals, and the Nursing Act, we will be able to prepare our young workforce for the challenges that they will face when they go and work anywhere in the world. British Indians are 2.5% of the population, but 18% of all doctors in the UK are Indian. Apparently, every 7th patient in the US is seen by a physician of Indian origin. So this is already happening, and this can increase multiple fold in the years to come. So therefore, there is really an opportunity for young Indians to heal the global aging citizens. And then this is in medicine, is in physiotherapy, in dietetics, as technicians, as counselors. Now, turning to the Indian medical device industry, we never made any PPEs till COVID struck. And then we became the second largest manufacturer of PPEs in the world in a matter of few months. 36,000 ventilators were established. Now we have medical device parks in 6 states. Another 4 states are going to have them. And India as the 4th largest market in Asia in terms of industry, in terms of medical devices. And that's not easy because you have China and Japan and Korea and Taiwan. So you have very stiff competition. But the idea is really for this to go up 5x in 5 years. India is the world's 3rd largest pharmaceutical manufacturer. 50% of global demand for various vaccines, 40% of generics in the US, and 20% of all medicines in the UK are made in India. And through Vaccine Maitri, we showed that we really believe in reaching out to the world by sending out 242 million vaccines to 101 countries. And through Arogya Maitri, our program, we have committed as a nation to support any country in the developing world that has a natural calamity. And we supported Turkey when they had an earthquake there. In India's G20 leadership, the world became aware of what we have believed in for millennia. Vasudev Kutumbakam, the world is one family. We are all part of one earth, we are one family, and we have one future. And in the years to come, as people talk about incredible India, they will also start talking about incredible health. For our GAPIO conference, the Honorable Prime Minister sent a message, and I just quote. He said, our worldview is anchored in our ethos of Sarve Bhavantu Sukhina Sarve Santu Niramaya, which means that may everyone be at peace and may no one suffer from illness. And with that ethos, I ask you, is there going to be stopping India from becoming the Vish Guru in healthcare? Jai Hind. Thank you.
Thank you, Dr. Sibbal. I think I had goosebumps at many times. I think we must have all had to be. Thank you for making us proud of our own nation and our history. And I was expecting a lot of applause, but a good, huge round of applause for our country again. So with that, since are instructed that inauguration will happen once our chief guest health minister will come, so whenever he comes, so I like to conclude this by handing over little love affection as a planter to our guest. So may I request our API's president, Dr. Anjana Samadar, to hand over a planter to Dr. Sibbal, Dr. Anupam Sibbal, our guest of honor. And I also request, can you come forward, ma'am? And I'll also request Dr. Bhavani to come forward, please, and for handing over planter to Dr. Srinivasa, also, Director of AIIMS. Thank you. And to other guests you'd like to give? Dr. Shubham, will you please come over and welcome all the dignitaries? And since Director of AIIMS is a very, very busy person, and I'm not very sure we'll be able to see him again at the time of inauguration. Yeah, he'll be there. That's good. So, okay. So, yeah, I am sure Dr. Srinivasan will be able to come back. But before we conclude, I will request Dr. Srinivasan also to give words of blessings to our delegates. May I request Dr. Srinivasan, Director of AIIMS, to kindly save you for words of wisdom for our delegates. Thank you.
Thank you. Good morning, everybody. I guess we are going to have a formal inauguration, and we will. The only thing is, I'm very happy that the entire world, Vishwaguru is here, already here. I think give a big hand to the organizers who have done this, bringing all the people, diverse departments, the experts from the various field, and unfortunately, the experts are so many that it needs a full medical college and institute to close down to listen to them. That's something which is otherwise, single theme CME's conference is very easy to do it. Somebody is talking about only neurosurgery, brain tumors, department can come or something. Now we have all the departments, all the people, all the experts, but the focus is on AI and ML. I think that's something which is very important for all of us. And I wish there will be good interactions between the people. The young minds are going to be ignited by the people over here. That's something which, these people are going to inspire us. And some of you will end up with these people again. Give a big hand to all of them. Thank you very much.